and we will get going. All right, thumbs up. Can everybody see this? We good? All right, very good. So we're going to talk about how to generate patients from Google without spending hours on SEO. Now, there's a couple of things I want to make sure that everybody understands. SEO is important. I am not saying it's not, but we're going to talk about some things outside of SEO that you can do to still be generating high quality leads from Google. So it's really good stuff. These are things that we've been using on some of our offices that's working really well. So we wanted to do a training on it. If you are not familiar with Chiral Candy and who we are, I'm the founder of Chiral Candy Marketing. We're a multi-million-dollar agency for chiropractors. Co-author of the book Tribe of Patients. This is me. This is Brady. He's actually the host of everything that's going on right now. But I've worked in office for multiple locations. So I'm not just, or we are not just some people who took a course on doing Facebook ads or whatever and started targeting chiropractors. For several years, I worked in office. We had multiple locations, and I was the marketer. I was the one doing all the screenings. I would go and I would do workshops out in the community. I would do our in-office workshops. Then I even started doing our day ones and our day twos. And we used to joke that the only thing I didn't do was I didn't handle any of the insurance billing, but also didn't do any adjusting because I'm not a chiropractor, but we used the Pro Adjuster. So I probably could have figured that out. But I've spoken at different chiropractic events all over the US. I've been fortunate enough to speak to chiropractors group in London, Paris, 3-time 2 Comma award winner. Basically, this just means we have funnels that we've set up that have generated over $1 million each. For that, we have the Chiral Candy podcast and some other stuff. We manage over $6 million in paid ads. This actually goes up quite a bit every couple of months because right now we're managing almost $250,000 a month in ad spend for chiropractors. We've worked with tons of different chiropractors. Currently, I think we have, give or take, 270, 280 offices that we're working with. But we have a lot of testimonials. If you want to go to our website, you can see those. Here is our team. Everybody is US based. They're all here in the States. We don't outsource any of the marketing or advertising on your accounts to people in other countries. Not that there's anything wrong with that, but we're here in the US. As a matter of fact, pretty much everybody now is in Texas. Well, we have one that's in Louisiana. But our mission is to help chiropractors and other healthcare professionals spread their message and generate high quality new patients. A lot of times, people will ask, so tell me exactly what it is you do. And if they're not, say they're not a chiropractor. And one of the things I say is, look, there are very few people, very few professions, if you will, that are as passionate about their message as chiropractors. Okay, you have, let's say ministers, right? They're passionate about their message. Chiropractors, maybe network marketing, people, they're pretty passionate. They're always going to be telling you. But chiropractors, you guys have a great message. And there are people all throughout your community that want what it is you do. We help you craft that message to get it out there. And so we're going to get into all kinds of strategies that we do. We're going to cover a little bit of Facebook stuff, but most of this is going to be about Google. So first, let's talk about the different mindset between Facebook and Instagram versus Google. All right. No one is going to Facebook and Instagram looking for a chiropractor. They're not. If they're going to Facebook and Instagram to, it's more like a social media, right? But it's more kind of like a party, right? They're going to go see what's going on with their friends, their family, classmates, coworkers, whatever. They are not looking for healthcare, advice on there per se. It's like doing a screening. We used to do screenings at the Bridal Expo and the fair and, farmers market, all these different things. Well, you guys know that if you're set up at the Bridal Expo, no one is going there hoping to find a chiropractor. But if you're set up, enough people stop by your booth that you will get some of those people to end up coming in for an appointment. That's what Facebook is like. Google, on the other hand, these are people looking for a solution. They went to Google, they typed in back pain, relief, or chiropractor near me, or something like that. They are looking for your services. So this is someone who is much more likely to become a patient, right? Or to actually show up. These are people looking for you instead of, people just on Facebook. So when it comes to Facebook, we developed what's called our Perfect Patient Tribe Turbine. And a lot of you guys may already be clients. And if you're not, even some of you that are clients, will be a good refresher for you. So when somebody signs up with us, you have your onboarding process where we get access to all your stuff, and we give you and your team access to some training. But we have an initial offer, and this could just be a consultation. It's whatever you would typically do for a new patient offer, and we promote it on social media. Well, this is going to a cold audience, right? This is like doing your screenings. In this training, the first half of the training is for your staff on how to follow up with the leads effectively. We have some really cool tips and strategies and stuff in there. But the second half of the training is showing you guys how to take your message in these small bite-sized videos and start promoting them on Facebook and Instagram, because they'll allow us to retarget people who watch them. And so we do that, and we start building this retargeting audience, and then we show them an offer. And what's great about this is now, instead of people saying yes to an offer, they're saying yes to the doctor, because they start to know, like, and trust you. So it's just a great process. It works really, really well whenever implemented correctly. And what we realized is we would also like to focus on, when you think about Google, and we were talking in a meeting one day, this has been several months ago, I was like, man, what if we could retarget people on Google? So in other words, they go to Google, but they don't call. What if they could now start seeing your stuff on Facebook? And so we started adding Google services to just a handful of accounts. I think right now we have maybe 35 out of 270 of our accounts. So just over 10% of our accounts that are now doing Google ads. And it's working really, really well. So that's kind of the whole purpose of showing you guys this. So you have your website, and then you have your GMB, which is kind of industry lingo for your Google My Business. This is something Google gives you for free. You just need to claim it, and then you need to make sure that you set it up properly. Your website, you want to do SEO for. Your Google My Business, you want to optimize it, and there's some things that we're going to show you how to do to get this optimized. But a lot of people nowadays, this is what they're responding to. They may not even go to your website. So we want to make sure that this is updated properly. So let's take a look. I used to live in Lumberton. This was my chiropractor. And this is Lumberton, Texas. And so I just typed in Lumberton Chiropractic. These results is here, or obviously his website. This is his Google My Business. So this is what a GMB is. So first off, you want to make sure that you claim it if you haven't done so already. But this, so we moved to the Woodlands area, North Houston, about 7 months ago or so. So there's a lot of stuff. I mean, we're always looking for, an eye doctor. We're looking for, we already found a chiropractor because we've got some clients in this area, but we're looking, different restaurants and things. And whenever we search it, most of the time we are interacting with their Google My Business. We're not even going to their website and stuff. So you want to make sure you have this optimized. This is, if you have a chance, you want to do a screenshot of this. We will also have a way for you to get since you register for this, we'll have a way for you to get all the slides if you want later. But WordStream is a company, they've got some really good material for just online marketing in general. But this is something they put together just this month. This was updated on 13 essentials, essential Google My Business optimizations to rank higher for local search. So they have 13 listed here. I highlighted a few main ones that you want to focus on quickly. And to find your Google My Business, you would just go to google.com/business and sign in, and you should be able to get it there. This is assuming you've already claimed your business. But you want to complete every section on there. Don't leave anything unattended. Like, you want to fill every single thing out that you can. You want to write a complete from the business description. A lot of this stuff you probably already have on your website. You can just kind of copy and paste. Upload new photos. They recommend doing it weekly. So something that studies have showed, for some friends of mine actually own website companies, and so we talk about this stuff all the time. When someone first goes to your website, one of the first things they do is they try to find a picture of you. And they may not even know it. It may be on a subconscious level, but they want to just see what you look like. So it's important to have that on your website. But even on your Google My Business, you want to have pictures of you, pictures of you with patients, people getting adjusted, your staff, everybody smiling, these happy type pictures. Those are attractive to people.
Sure.
So just like Dr. Walker right here, the first one we see is him with, this is actually his daughter. But so you want to make sure you have tons of pictures and stuff on there. You can actually even upload videos there.
So one thing on that real quick is I've noticed, especially on restaurants, if you don't upload your own images, what happens is it will take pictures that people leave when they post reviews, and it'll automatically put that on there. Now, I would imagine that probably none of your patients also put pictures when they put reviews for you guys on Google. But that is just something to keep in mind. And you'll probably start noticing this now when you're looking for restaurants and things to eat. The pictures there, if the owner of the business doesn't put any, it's just going to pull from whatever pictures were posted on their reviews. So it is really important to make sure that you put your own professionally taken or just pictures that you take on your iPhone, put those on there. That way you have at least something there.
Very good. Something else, like right here, number 10, collect and respond to reviews. Reviews are huge. And I'm going to show you some things. We're going to talk about some really cool strategies to boost your reviews. But this may be one of the most important things that you can do for your Google My Business is get more reviews. One, because Google says, okay, look, a lot of people like this, so they're going to rank it higher. But also the social acceptance. When people are looking, they are going to go to who has the most reviews. I remember even, on the Amazon app, I may be at a store here locally looking at something, and if I'm interested in it, I'll pull up Amazon just to look at the reviews, for that object. I remember Brady, back whenever it's been years ago, but he and my daughter Taylor, they had gone somewhere. They told me the story whenever they got back, and they were shopping for something, and then they're both on their phones. And then they were asking her, are you on Amazon? Like, yeah, me too. Just looking at the reviews. And then they kind of made a comment, because that's what I always do. But people look at reviews. The social acceptance is huge. So you want to have some campaigns and some strategies in place to always be building your reviews, but also set up messaging. So those of you who are clients and you're using the Chiro Candy app, or even if you're not our client, but you're just using the app, we are working with the developers right now. It's kind of in beta, but we're working on having messaging set up to where somebody responds on the Google My Business. So it would actually be an option, like right here, would be message us. It'll show up on your Chiro Candy app, and you can respond to them immediately. So that's going to be really, really cool. But once you log into your Google My Business, here's kind of what it looks like. And this is just a list of all the menus on the side, okay? And you just want to go through here and make sure everything is complete. It's really pretty simple. They do make it fairly easy, but you want to make sure this is complete. So if we go to this next page here, so here I just typed in chiropractor, Lumberton, Texas, and we see Dr. Walker, or Lumberton Chiropractic. He's number one here in the 3-pack. So this would also go straight to his Google My Business. But if you look, he has 47 reviews, 7 reviews, and 3 reviews. So the other and actually these are all within 1 mile from each other. But he dominates mainly because of the reviews here. Here is his page from SEO. But look, this is his Facebook page. But it's because he has all the reviews. So back at the end of 2015, so 5 years ago now, 5.5 years ago, not quite that long, we did a campaign to build Facebook reviews. And then in March of 2016, we did one to build Google reviews. And so we did that 5 years ago, and he's still dominating from the work we did 5 or 6 years ago, just because nobody else in town, they're working on their stuff. So this is some really cool stuff. So let's talk about one of these strategies, and we call this a review referral campaign. Now, I will say this is, I don't want to call it black hat. We'll say a little bit gray hat. Obviously, Google does not want you to set something up where you're saying, hey, if you write a review, I'm going to give you a $25 gift card, to wherever. They don't like that. They don't want people to be rewarded for that. So we don't necessarily do that. We set up a contest, and we call it a review referral contest. Now, what we used to do, well, I'll get into that in a second. So this was the second one we did. This is the one we did in March. And the reason I want to use one that we did from so long ago, because we can still do stuff like this now, but this is just showing it was done so long ago and the results that are still getting today from this work.
Yeah, that's the thing, is like, you get a Google review, it's there forever. 10 years from now, if he's still practicing, those 50 Google reviews, they're still going to be there.
Yeah, they're still there. Great point. So you do a short video. You find something you're going to do as a giveaway. Here was a Garmin Fitbit watch, not a Fitbit, a Garmin activity tracker. The first time, the one we did for Facebook, he actually got a Google Chromebook. It was like a $200 laptop. So a lot of perceived value, wasn't very expensive. But this isn't marketed to everybody in your community. We only market it to, or you only market this to your database. So what we used to do is we would upload your database to Facebook. Now, Facebook doesn't make it that easy to do. It's very, very difficult to do. So now what we do is we would do like a reactivation campaign, like where we would send out a text message to everybody in your database. You do the same thing for reviews. Hey, we're doing a contest. Click here to watch a video from Dr. Walker. And then they would go to some landing page. And these videos are very short. In this video, he basically says, hey, Dr. Walker here, and we're doing a contest. We're going to be giving away this Garmin. All you have to do to enter is write us a review on Google. That'll get your name in the hat one time. So that'll get you one ticket, or send in a referral, and that gets you 5 tickets. We're doing the drawing on March 31st. Good luck. Like, that was it. The video's maybe 30, 45 seconds long. It's not very long at all. And you also want to promote this in your office. So you could print up a flyer. You want your staff to be, staying on top of this and also keeping up with your referrals. So this is what we did. And the way it looked is we sent this message to the database. Okay. Now, what we used to do, like I said, is we would run an ad on Facebook only to your database. It goes to the landing page that we just saw that has a video explaining what's going on. And then they had an option of either writing a review or sending in a referral. And that's how it's done. So the first time we did this, we focused, like I said, on Facebook reviews. He had 47 reviews written, 14 referrals came in, and he had 10 reactivations. We weren't even going for reactivations, but he had about 1,500 existing patients in his database, and a lot of them hadn't been in a while. And just because they started seeing his marketing, even though it was about this, it was like, oh my goodness, we need to go see Dr. Walker. So we weren't even expecting this, but he had 10 reactivations. He spent almost, I think, probably $220 or so on the Google Chromebook. And his ad spend, now you don't even have to do ad spend, but the ad spend, because it was a smaller audience, was like $150. So $400, and this generated just in the next couple of months, like $10,000 to $12,000. But these reviews are still giving him credibility today. His Facebook page ranks for Lumberton or chiropractor in Lumberton, Texas, because of these reviews. And then we did it in March, and we didn't keep up. I don't remember how many referrals or reactivations he had then, but he had over 30 reviews written when we did this one. So, skip ahead 3 or 4 months, did it again. And so it works really, really well. So look at this. Let's pull this back up. 47 reviews, ranks him number 1 here. He's already ranked here and then here. So he is still getting tremendous results from work we did 5-6 years ago. And he sees around 250 patients a week. It's just him. He has no associate, and he's only open Monday through Thursday. So it's a very solid practice. And this is where he gets a lot of his patients now.
Let's go ahead and feel the room. Why don't you drop in the chat? How many Google reviews do you have right now? So we got 170. Charlene messaged me separately, said they've got 84, 55, 41, 84.
And it's so important. I know like Dr. Dice is one of our clients outside of Fort Worth, kind of the Dallas-Fort Worth area. This is one of the things he's big on all the time. He's always doing different Google reviews. And last I looked, I think he had over 200, give or take. But he knows how important this is. And especially that's such a big market and there's a lot of competitors up there. You've got to be staying on top of stuff. And also, you are probably going to eventually get a bad review. It's just, some people would write a bad review about their mom. It's just part of it. That's another reason it's so important to make sure you're getting good reviews. You have some kind of system in place to do that, to offset any negative reviews that you may get. So right here.
Real quick,
yes.
Dr. Chase Dice, Trinity Chiropractic of Burleson. I actually just talked to him today. He's currently raised his practice from around 300 1 or 2 years ago. Now he's seeing about 500 visits a week. But that being said, he has 437 reviews on Google. The second highest in his town is right under 400. And so that's got him ranked really high up there on.
Yeah, that's awesome. And because I remember whenever he first started working with us, he had just over 100, like that he had already got on his own. And so, but they have systems in place to help get those reviews. So it's so important and it's not that difficult to do. So this is, Lumberton Chiropractic stuff. You can see just all the traction he gets just from his Google My Business. And that's only 47 reviews, but nobody else in town is anywhere close. I mean, they can obviously do a lot better job on this. They're not clients or anything right now, haven't been in several years, because he doesn't want to see any more people unless he had an associate. There's only so many you can see by yourself. But so much of this is from the work that we did, setting up that campaign, several years ago. And we've seen people give away Google Chromebooks, Fitbits, TVs, bicycles, barbecue pits, iPads, AirPods, a nice cooler. We had somebody do one time, I thought this was really cool. They got with a group, kind of like a CrossFit type gym. It's like one of these group gyms that do the group classes, and they got a free month of services donated. And then they did, they weren't AirPods, but they were like Bluetooth, kind of like AirPods, and also included a Fitbit. So it was like they were promoting this kind of fitness package that you would enter to win if you wrote a review or sent in a referral. So it's very, very cool stuff. So let's talk about Google Ads now. So we talked about Google My Business, we talked about reviews. Let's actually look at the Google Ads. So this used to be called Google AdWords. Now they just shortened it to just Google Ads. If you watched the webinar we did the past 2 months, the one we did in January, the one we did at the end of February, we talked about this level of awareness. So on Facebook, or really in any marketing, you have a group of the population that's unaware. They're unaware of any problem. Then you have those that are aware of a problem, solution aware, product aware, and most aware. So on Facebook, we want to, the whole purpose of that Perfect Patient Tribe Turbine and getting those messages and stuff out there is to bring people to the top of this pyramid. We want them to be like, oh, you know what, maybe I do need to see a chiropractor. You know, chiropractic's more than just back pain and neck pain. And you start educating your community, and it pushes people up the top of this awareness funnel or awareness pyramid. Well, with Google, they're already at the top. These are some of the hottest leads you can ever get because they are looking for your services already. So, and we even talk about how to turn this upside down and make it more like a funnel. We're trying to work all these people, you know, qualify them and get them down here where they're ready to take action and using retargeting and stuff. But with Google, they're already the most aware people you can get. That's why they're searching for you. So that's another reason that it's so important to be able to capture as many people as you can straight from Google. So whenever we do this together, when we do Google and Facebook, it just dramatically increases the quality of leads you get on Facebook. So let's say that you're already doing content, you're doing some videos, and you're getting some decent quality leads on Facebook already. Think about the people that go to Google. So let's say that you're already getting 5 to 7 people from Google already a month. Great. Not everybody that finds you on Google calls. And it's not that they're not interested. It may be that the doorbell rang, the phone rang, the boss walked in, the baby started crying. I mean, there's 1,000 reasons people may not, you know, may have looked you up on Google, but didn't call. Well, now we get to retarget those people. And so now when they're on Facebook and they start seeing your content videos and all this stuff, you're all of a sudden you're everywhere. So we talked about this last week, last month in the webinar we did on, 7 strategies to generate higher quality patients. We talked about retargeting. And so now we're not only retargeting people on Facebook, we get to retarget those hot people from Google. And so putting the two together, Facebook and Google, has been a game changer for a lot of offices. So yes, you can do just Facebook, and yes, you can do just Google, and you can do well. As a matter of fact, I had a call with a guy, Dr. Mike. He actually called me earlier. He's like, look, I want to be on the webinar. I have a scheduling conflict. Is there going to be a replay? And he's a fairly new client. And he's like, look, we have 2 offices. Also need to set, we're doing so great with just Facebook. I also want to add on an additional office. And so we started talking about that, started talking about Google. And he's like, look, I haven't even, we're getting great results already. And we're not even doing the videos I know I need to be doing. And so when you can do all of that together, when you're doing the videos and you're doing everything, it just dramatically increases the quality of leads that you get. So, going back over this, not only are we retargeting people, that are already seeing your stuff, the people, let's say Google was over here, right? They went to Google and they found you. We get to put them in here, and now they're going to start seeing all your videos and stuff too. So it just works really, really well. So let's get into a little bit of the specifics about a Google ad. I'm assuming most of you guys know what Google ads are. Google, they say it's an ad, right? When you search chiropractor near me, this is a screenshot I did in here. Look, it says ad. So these are Google ads. So right here we have The Joint. This is a functional medicine office here in the Woodlands, back in Pain Center of Texas in Conroe. And then here's even an ad right here at the top of the pack. But other than that, look, I'm trying to scroll down on this. Sandstone Chiropractic, they have, out of all of these listed, they're the first one organically because they have more reviews than anybody. So it just shows you've got to be getting these reviews. But these are the different ads that's showing up. So what are some keywords that you want to target? Chiropractor near me, that's a great one. Chiropractor in my city, in my area, or chiropractor in, like I did earlier, in Lumberton, Texas. So those are some great ones to start off with. when we're doing this for an office, we have between 10 and 15 keywords, depending on what areas we're in, that we go after. And then we monitor them to see which one's working the best and so on and so forth. But if you had, think about if you were doing Google ads and you were already on top here because you had the most reviews, then that's going to be a no-brainer of, who's going to respond to it. So here's a case study from Dr. Jeremy's, one of our clients. And he started running, he's been with us for a while, just started running Google ads within the past couple of months. But on Facebook, on Google, we're only doing chiro ads. He had a $400 budget for Google for his ad spend. He had, in this particular month, this was a 30-day period, he had 669 clicks that went to his landing page. This is retargeting gold. Even if none of these people signed up, the next time they're on Facebook, they're going to start seeing his videos. And this is actually one of his videos he did on decompression. So a lot of these people now on Facebook are seeing his stuff. So over 100,000 people actually that's how many impressions he had. So how many people actually had a chance to click on his ads? He only spent, out of the 400, only spent 387. Cost per click was 58 cents, but what really matters? This really doesn't matter. This is what matters. In this 30-day period, he had 20 leads from Google, just under $20 a piece. But these are incredibly high quality leads, right? These are hot leads, people who need your services right now. And it's increased the quality of his leads he's getting from Facebook and Instagram because we're retargeting all these people. So this is why you want to not just have one area. You want to be able to use this in conjunction with some of your other marketing. It just works so well. So
one thing to keep in mind here, guys, is your typical Facebook lead. Facebook leads typically convert at around 30%, or at least that's what we see on our end. Is we want a minimum of your Facebook leads to convert 30%. Whereas from Google, we see it's closer to like 80% or more of your leads that come in from Google convert, not even to mention the people that come from Facebook because they saw your retargeting ads because they first saw you on Google. And so it's just such a higher quality lead and you're going to convert them a lot higher statistically into care compared to your typical Facebook lead.
Yeah, and this was just with a $400 budget, so that's great. A tip about this is we want to send them to a funnel, not just to your website. Now, the issue with sending somebody straight to your website is there's a lot going on. Now, we still want to have the retargeting pixel and stuff like that set up on your site in case they do go. We want them to start seeing your ads on Facebook. But from an ad, we want them to go to a funnel because they don't have all these different options. The only thing they can do is there's three things. They can either fill out a form and then schedule an appointment. Number two, they can call the office. Or three, they cannot do anything. And you know what? If they don't do anything, that's kind of okay because now they're in a retargeting audience and they're going to start seeing your stuff over and over and over again. So whether it's Facebook or Google, you send them, whatever the ad is, send them to a landing page. A lot of the Google leads, it's very, very common for them not even to fill this out, to just call the office because they're searching for you. They're looking for something right now. So this is very common, just to have them just directly call. But even if they fill this out, if you watch the webinar we did last month, this is actually a slide I just took from that webinar because we talked about having them schedule and prepay. Brady, do you want to talk anything about this real quick?
Yeah, this is an awesome opportunity where you're actually able to have your leads, whether they come in from Facebook or Google, actually pay for their appointment online before they even talk to you guys. Now, we use our Chiro Candy app to do this, and we integrate it with your Stripe account. Stripe is just an industry standard payment credit card processor. And what you can do is, let's say your offer is for a $47 exam, right? Well, after they sign up and claim that offer, we then take them to a schedule page, which we can integrate Stripe with that scheduling page and say, hey, please request a day and time for your appointment below. And if you prepay, we'll include X, Y, and Z. So we create some kind of incentive to actually get them to prepay, because what we found is if all we do is ask for the credit card, it's a huge barrier to entry. And a lot of the times it just won't happen unless you do something to incentivize that. So for example, you could offer an additional discount if they prepay online. So instead of $47, it's only $27. Or maybe you could say, hey, we'll include x-rays at no additional cost, or we'll include your first adjustment at no additional cost. So these are some things that typically you could, in theory, include that on that front end offer. But if you just don't even mention that on the ads or the landing page until you get to that scheduling page, you have the opportunity to get them to prepay online. And if you get all of your leads to prepay, they've got skin in the game. You're basically avoiding no-shows. You're getting your leads to call you and basically reach out to you saying, hey, just want to confirm, you got my payment that we're good to go on this day, rather than you having to call them and chase them down to get them confirmed for their appointment. And so that's why I love the prepayment, which works great for Facebook or Google.
And something else I want to make sure I included this. I know it's kind of small, you can't see it. Let me just blow it up real quick. I wanted to have this on here because it's so important on how fast your team is responding to these people. So this just shows that if a lead comes in, if you can respond within the first minute, there's almost a 400% increase in that conversion. But 2 minutes, it drops to 160, 98, 62, 36, and like 62%. This is after 30 minutes. And I will say this, we have some offices that kind of complain about this. You know, we're not getting conversions, but they're only following up a couple of times a day. Like they're not following up whenever every lead comes in. They just have time set aside, and that, you know, after lunch, they're going to go and follow up with anybody that came in. No, you got to have somebody on top of this that is just, this is their job. As a matter of fact, Danielle Kaufman, a client, they have multiple locations with this. She was telling me they actually have a team member that doesn't even work in office. She works out of her house, but the only thing she does is follow up with the leads, and she gets paid a bonus depending on how many come in. So they tell us, look, you send us the leads, she's going to make sure they come in. But she just stays on top of it. As soon as these leads are, you know, she's getting notification, she's staying on top. So that's something else that you want to do. Getting a little bit off subject, but the quicker you can respond, it makes a huge difference. So this really wraps up a lot of the strategies and stuff we want to talk about. So let's kind of go over some takeaways. You want to optimize your Google My Business, make sure everything's filled out, make sure you have pictures on there, you have your times. You want to build reviews and also respond to those reviews. When somebody writes you a positive review, respond to it. You know, thank you so much. We love having, you know, you're a joy every time you come in the office, whatever you want to say, but respond to the reviews as well. And then implement Google Ads and Facebook together. Just the combination of the two has been game changer for so many of our clients. Even if this is stuff that, you know, you have the staff and you can actually, you're doing this yourself, make sure you do both. It works really, really well. Yeah. Travis, do you have anything? Travis kind of heads up all of the Google stuff for us. Do you want to, Brady, do you want to maybe spotlight him? I mean, if you even have anything.
He's already spotlighted.
I'm already here. Yeah. Honestly, Billy, you covered like just about everything that I could think of. I've seen great results with Google Ads mixed with Facebook ads. Just get a lot of good quality leads rather than just a bunch of leads that, you know, maybe click on your Facebook ad and don't show up. Just like Billy was saying, they're searching for you. So they're already ready for care.
Yeah, this is such a great strategy.
So hey, I do want to add something, a little bonus. One of the most important things that you can do to actually get a patient into your office is getting in response with them as quickly as possible, right? Going back to that lead follow-up time chart. Dad, can you real quick open up a new tab and head over to our website? I want to go over the web chat feature. So this isn't even on part of the slides. I just want to kind of go over this as a bonus, but one of the things that we've done in-house is we added a little web chat pop-up at the very bottom of every single web page on our website. And so as you see here, yep, down at the bottom,
this is just our podcast page too. This isn't for our marketing stuff, but you can see.
Yeah, so this has been game changer for us internally, and we've added it to a lot of our clients' websites too, but it allows your patients to automatically reach out to you very, very quickly. And this is 100% included, no additional cost with your Chiro Candy app. So if you are a Chiro Candy client, this is free of charge. You get access to that. And what that does is once someone fills out that form there, it will basically send you a text message on the app on your phone, and you're able to reach out to them quickly. That's one of the best ways to get in contact with a patient. I told this last webinar, but I'm going to tell this story again. One thing that me and my wife did is once she got pregnant, we wanted to find a chiropractor in our area that specialized in prenatal care for patients. And one of the things I did was I searched on Google pregnancy chiropractor or prenatal chiropractor. And I went to probably 3 or 4 websites that I found on Google of different chiropractors in our areas. And I filled out the form requesting more information. And guess what chiropractor we went to? I went to the first chiropractor that reached back out to me to schedule an appointment. Right. And so one of the things, if you guys know Grant Cardone, one of the things he says a lot is best known always beats best. So even if you are the best chiropractor in your area, it doesn't matter if you're not best known, right? So you want to make sure that you are being able to reach out to these patients as quickly as possible. And so this little web chat pop-up is a great tool for you guys to utilize in-house on your website. Now we've got a few questions here in the chat I'd like to go over. Monica asks about auto response for campaigns. So we do have a hybrid model to where once a lead comes in, we do have automated messages that go out to them. But what we found is if we try to use AI, a lot of the times it just doesn't make up for that human interaction. So we've developed a hybrid model to where we do have automated messages that go out, but we still have our clients reach out on the phone with our leads that we send them just to confirm their appointment spot. And because we have the automation on the front end and we use the Chiro Candy app to allow their leads to request days and times for appointments, it makes our clients' CAs and their staff's job a lot easier because they just have to call their patients that signed up from Facebook and Google to just confirm their spots that they requested rather than having to chase them down to get them into the office. And so we do have some automation in place, but we still ask our clients to call their leads to confirm their appointment. And that's helped tremendously, especially when we add the prepayment option for their leads. Another question by Mark Pepping. We've got how much money should we be spending to drive enough leads? And so from Dr. Jeremy De Los Santos's example, he spent $400 on Google ads and had 20 patients sign up from that. And so that's what we recommend as a minimum. We do have a lot of clients that spend 2, 3, 4 times more than that on their Google ads, and they're killing it.
And it's also going to matter. It's going to depend on what area you're in. You know, if there's more people, especially on Google, for example, you are actually competing for those keywords. So if there are other people in your town or city that are willing to pay more for those keywords, you know, then they may be seen first. So it just depends on what area you're in as well. That is going to make a difference.
Yeah, we had another question come in here about what schedule do you use to integrate with different software? So we use our own software in-house, the Cairo Candy app. It has its own calendar feature. And now it doesn't integrate with your in-house EHR that you guys use. So what we do for our clients is we just put their typical availability on when they're normally able to see new patients. And then the verbiage we use on the funnels and the ads, we tell the patients, hey, please request a day and time for an appointment. These times are tentative and need to be confirmed over the phone. And so that way the patients know that they're just requesting a day and time. They're not actually booking it and it's not set in stone. And that creates the mindset for the patients to be looking for a phone call from you when you call them to get them into the office. So I hope that answers your question there. So any more questions?
Let me go over our fees. So I know this is probably a roughly 50-50 as far as how many people are clients and existing clients, and then people who maybe aren't clients. So for Facebook and Instagram ads, the first month is $15.95, and then it's only $5.95 a month after that. We do have a program where if you refer 3 offices to us, as long as those offices are active, we actually will even waive this $5.95 and we'll do your Facebook and Instagram for free. If you want to add the Google services to it, it's only an additional $3.50 a month. And then, like we said, we really recommend a minimum of $400 a month for ad spend for Google, but we do have some people that do more than that. And so once again, here's our team. And if you are not a client and you're just interested in having a conversation about what that would look like, you can schedule a call here. Just go to cairocandy.com/schedule. If you are currently a client and you want to add Google onto your services, all you have to do is reach out to whoever your rep is. Reach out to your rep and they can get you sent over what we need to get started and to get access to your Google account, stuff like that. It's very, very simple. And we already have all the campaigns in place. And so it doesn't take us long to get going. So that's it. If y'all have any questions, is there any other questions before we wrap up?
Yeah, so Curtis asked about getting instructional videos on setting up Google ads for Chiropractic Marketing University students. Yeah, so we actually had Travis record some more training for our team. So I'm going to look at that. And if it's applicable for you guys, I will go ahead and just upload that training into CMU and you guys can take it and run with it. Otherwise, if there's some changes that we need to make it more applicable for CMU students, I might schedule time with Travis sometime within the next few weeks to record a training for you guys specifically on that. And so for those of you that are curious about what I'm talking about, CMU, Chiropractic Marketing University, is a training program that we provide to chiropractors on how to set up and manage your own ads. If you're interested in that, you can go to chiropracticmarketinguniversity.com to learn more and sign up for that if you're interested.
Well, I think that's going to pretty much cover it. We will have a replay of this. And so you guys are all on here because you registered, like you didn't just stumble upon this. So you will be getting a replay link. We will send that out. On that page, there will be a link for you to download the slides. If you just want to go back and flip through the slides, you'll have that on there. So we're here to help. We will be doing another webinar at the end of next month. And next month, we're going to be talking about how to write a book. If you've ever wanted to write a book, we're not going to be talking about how to write a book that's going to be a bestseller. We're going to be talking about how to create a book that you can use for your practice as a fancy business card. We've been doing this for several years. We've actually been writing books for clients longer than we've been doing Facebook and Instagram marketing. So, but it's some really cool stuff. And that will be the topic we cover at the end of April. So that's it. Thank you guys so much for your time. And if there's anything at all we can do, reach out. We're always here to help.
Awesome. You guys have a good one.